Hello, good afternoon everyone. It's me again, Arlene. And as part of my Philippine retirement series videos, today I will be sharing information regarding healthcare costs in the Philippines. So, to start off, how much does it cost to see a doctor in Philippines? To see a doctor in Philippines, normally the doctor's fee would range from 300 to 500 pesos depending on specialty. So 500 pesos will be around $10 and that's for private hospital. Now if you're gonna go to a public hospital, that would normally be one third to one half of the cost. And to be honest, in some cases, I've seen also doctors who are not asking for PF, especially if they know that the person has no capacity to pay. But I think for the most part, most of the Filipinos and the foreign people watching this has the capacity to pay. So whether or not you're seeing a doctor in private or public, please do give some PF fee, even if you're seeing a public doctor. Now, the next question, how much does medications cost? Well, there are two things. If you are using generic drugs and if you are using branded drugs. If you're using generic drugs, usually these are manufactured in the Philippines or they were imported from another country, mostly India. So if I'm going to compare it to India, I would say that the price would still be a little bit cheaper if they're from India, but of course you have to consider the shipping cost. So some pharmacies in Philippines do import from India rather than buying it from Manila, where most of the local generic drug companies are located. So if you're gonna buy from India, you can do that. Just make sure you're buying in bulk just to compensate for the shipping cost. However, in itself, if you're buying from Philippines and say if you're comparing it with the price in Costco, the difference is very minimal. All right, so however, the difference would be significant if you are buying branded medications. Say a certain medication that's produced by AstraZeneca or Pfizer or J&J or other big pharmaceutical companies who are selling drugs in, say, the US and in the Philippines. Although they are same manufacturers or same drug companies, they will be setting a different price in the US than a different price in the Philippines. And the difference is huge. And this is where you will really feel that the drugs in your country is overpriced relative to the drugs in the Philippines. And based on my personal opinion, my parents, for the most part, they're always say buy the branded ones because we can afford it, even though they are like produced by all these big pharmaceutical companies. We can still afford it. So this gives you an idea that yeah, it's really much cheaper to buy branded drugs in the Philippines than say buy the same branded drugs in the US or in Japan or in any other first world country. So one more thing, what if I need insulin? So just as a reference point, a vial of insulin would cost you $10 and probably in some pharmacies would cost you maximum $15 per vial. So let's say the middle ground is $12 or 12.5 or $13. And the pen, the insulin pen, 300 units would cost you $20 a pen. And I'm not gonna elaborate on how much you're paying in your country, but you just, these are like branded insulin pens and vials, but it's this cheap in Philippines. So compared to US for the same brand. So you can just see the disparity right there. One more thing, if I'm gonna use say a hospital in Philippines, we have three JCIA accredited hospitals in Philippines, And of course, we have a lot of hospitals which are not JCIA accredited. Now, JCIA is like an accreditation body which gives certification to all hospitals worldwide. And if you are JCIA accredited, you pass like the supreme test of being an A-level hospital, right? Regardless of whether you're in the US, you're in Canada, or you're in another or in Singapore or in Philippines, if you're JCIA accredited, you pass the stringent test and you're like creme de la creme of all hospitals. So we have 3 JCIA hospitals in the Philippines. It used to be 4. So these 3 JCIA accredited hospitals are St. Luke's in Bonifacio Taguig, St. Luke's in Quezon City, and the third is the Medical City. So we have Chonghua in Cebu City, which is in the southern part of Philippines, which used to be JCI accredited, but now they're not JCI accredited anymore. But it doesn't matter. It doesn't mean that just because you're not JCIA accredited, the standards are poor. Because I know a lot of hospitals, even in the US or in the UK or say in Singapore, are not JCIA accredited, but they're like big major hospitals of the country, right? So I'm just saying that because if you would go to say St. Luke's Hospital, which is like the premier hospital, JCIA hospital in the Philippines, you would find there in their website medical cost estimate, which claims that using St. Luke's Medical City as your healthcare provider, you would save 63 to 83% compared if you have the same surgery in the US. And on top of that, they're also comparing the price of St. Luke's in Philippines to the prices of, let's say, if you had the same procedure done in Malaysia, in Singapore, in Thailand, and in South Korea. So I think with this in mind, and this is like St. Luke's, this is the one that charges the most money, more or less on average in Philippines when it comes to cases and surgeries. But still, it comes off as cheaper than if you do it in the US by 63 to 83%. At least that's what their own website is claiming. And it's even cheaper in, say, another country, I think, except or comparable to Malaysia. But they're saying they're also cheaper than Thailand. So you will see that if this is like the premier, most expensive hospital in the Philippines, and you get this big steep discount if compared to if you do it in, say, this Asian country, or if you do it in the US, how much more if you're using a Philippine hospital which is not St. Luke's? You get what I mean? So this is just to show you the price disparity and how you can actually stretch the money in your insurance coverage. And also, looking at your health condition and your health history, you would have an idea, okay, so my health history is like this. Maybe I need a health insurance for, say, 2 million or 5 million or 1 million. So you would have to check the case rates for the country in Philippines, and also not just in St. Luke's but in your local hospital, because if you don't live in Manila and you live like, say, in Cebu, then you have to check the case rates for say the same surgery in Cebu, and you will see that it's really cheap. I mean, I will probably put a link down below to give you how cheap it is, these procedures and this diagnostic test, if you do it in the Philippines than if you do it in your country, and you'll be amazed. One more thing is the public and the private healthcare insurance in the Philippines. So in the Philippines, we have what we call Philippine Healthcare Insurance Company, which is the public healthcare insurance system in the Philippines. But it also caters to foreigners, whether you're on a retiree visa or you're just a foreigner who is residing or working in the country. So it doesn't matter whether or not you have the retiree visa, you can still self-pay in the Philippines to have PhilHealth. So PhilHealth is very handy because for the price of, say, if you're a foreigner, you will be paying 15,000 pesos, which is like $300. And if you don't have a retiree visa and you're a foreigner, you will be paying 17,000 pesos, which is like a little over $300 for a year's worth of coverage. And this will include and is applicable to your hospital admission, room and board, discounts on the case rates, meaning whatever is your diagnosis plus whatever that diagnosis cost you while you are inpatient, plus the diagnostic test, plus the outpatient benefits. So even if you are not hospitalized for the year, you can actually use the outpatient benefits of PhilHealth, isn't it? Which would include, your lab works, your probably your X-ray and ECG, and it's like you were able to use it. And if you weren't able to use it, your dependent, which is your spouse, and at least one child can use that same benefit even if you're the only one who paid. So that's actually really great. However, as a disclaimer, if you're a foreigner or if you're previously a Filipino but you didn't apply for a dual citizenship, then the Z package will not apply to you. But even without the Z package benefit of PhilHealth, all the other benefits would apply to you. So in my opinion, it's totally worth the $300 investment for a year's worth of coverage, considering that it covers not only you but your wife or your husband and your dependent. Plus, you can always use the outpatient benefits for your annual executive checkup, isn't it? So then we have, on top of PhilHealth, which is what's for me the most practical thing to do, get PhilHealth plus the private healthcare insurance. So we have, like what I said, in my family, for my parents, I'm paying right now for my national insurance here in the UK $370 in dollar terms, okay, per month for my national insurance coverage in the UK. Now that same $370 is what it cost me to cover my mom for a year, and she's 58 or 59 years old. And that's her yearly premium. So that's like my 1 month is her 1 year. So you can just imagine the price disparity. So for example, in my family, what we do to make sure we're getting the most out of our payments, we just use the semi private plan for the private healthcare insurance. And then but when my family is admitted, we use the private room plan. We just pay the difference, and it's like just a private arrangement between you and the hospital, because it's not every year that somebody will have a surgery or somebody would have a hospitalization. But at the end of the day, if you're the type who's always getting hospitalized and you always want the private room, then it's still affordable for you. And like what I said, depending on your health history, you have to have an idea of how much healthcare insurance coverage you would be needing for the year. Now we also have options with our private healthcare insurance to have coverage from years 0 to 100. So from the top of my head, I only know 2, but there could be more because you can just Google it away. One that I know is AXA. They cover until 100 years old. And then the other one would be AXA and forgot. There's 2 of them at least that I know of. I kind of forgot. So how it works is you pay for 10 years or 20 years or until you're 65 years old, depending on how much you can pay per month. And once you finish those payment periods, the benefit for, say, let's say you opted for a 2 million or 1 million or 5 million benefit, you can use it until you are 100 years old. So we also have that option, or you have the option to just use private insurance, which insures you for the year, and then after that you again, get the same insurance for the next year. And discussing the insurance would, of course, there are a lot of fine prints, so just be careful with the fine prints. But I think this is something that is beyond this YouTube video. But like what I said, what you're gonna pay per month in your country is probably what you're gonna pay almost per year here on private insurance. Now, if you're a Filipino who have reacquired your Filipino citizenship, let's say you're both an American passport holder and a Philippine passport holder, then if you have a Philippine passport, you're gonna pay only 2,400 pesos for PhilHealth. So 2,400 divided by 50, so that's gonna be your 1 year payment to PhilHealth. And you have all the benefits of PhilHealth plus the Z benefit. And the Z benefit is like, it's massive because it covers coronary artery bypass benefits, kidney transplant. It also covers cancer benefits on a 2,400 yearly payment, which is like nothing, isn't it? It's almost nothing. So for a year's worth, and that includes your dependents. So if you have a child, that includes your children, your kids below 18 years old. So in my opinion, these are like big savings. So if you're a foreigner and you would like to know more, what I'm gonna do is I'm gonna put links below my video so you would have an idea of how much a case rate is for, say, appendectomy, or you have a hip replacement, or you have your gallbladder stone removed. And then of course it's not going to be comprehensive, but you'll have an idea, and you'll have an idea whether your healthcare insurance would be enough to cover it, because some of you are coming to the Philippines without the healthcare insurance. So you have to know what your risks are and how much the case rate is, so you know how much coverage you should get for the year. And I would really suggest to get a healthcare insurance as soon as possible so that you can prevent the exclusion clauses. They say if you've had this before, we're not going to cover it, isn't it? So we don't want that. So get a healthcare insurance as early as possible so you can avoid these exclusion clauses in your healthcare healthcare policy. So I'm gonna put some links below about PhilHealth, about St. Luke's and the medical city, and about examples of case rates here in the Philippines. And with regards to the healthcare insurance that you already have overseas, I don't have a comprehensive idea whether or not you can use it in the Philippines. So it's up to you to ask your healthcare provider whether you can use them in Philippines. But if not, you can always have one from Philippines, and it's probably cheaper. But again, you would have to think about the exclusion clauses in the policy. So I hope you find this useful. Oh, by the way, EpiPen. So epinephrine pen, the best way to get it if you're asthmatic and you want to make sure you have one is you have to ask your doctor here in the Philippines, ask for it. And 2, you can buy it from pharmacy, but normally you would get it in ampoule in a box of 10. So you have 10 ampoules in a box. So that box containing 10 ampoules would normally cost you like 600-700 pesos, which is like $12 to $14. But you have to buy the syringe to self-administer it yourself. Probably we don't have EpiPen itself. Maybe it's not available with your doctor, but he'll probably prescribe or give you the same epinephrine, but from a different brand. And the best ways to get medications in the Philippines would be one from Mercury Drug. These are like the known drug store chains, Watson's Drug, and all other drug franchises like the generics pharmacy, and the other one is Generica. They sell the generics drug in the Philippines, and they are the biggest franchises of that. So yeah, you would not have a hard time, especially if you just came from a consultation. The hospital usually stocks the medicines, so you can just buy it from the hospital. And the difference between the price in the hospital and the price outside is just minimal. It used to be big, but now this hospital pharmacies realize that the people are not going to them because they're overpricing their drugs. So in the end, what happened was these hospitals start to match the price from the pharmacies outside to the pharmacy inside the hospital. So in the end, it's like a win-win for the customers and for the patients. And one more thing, when you're in the Philippines, you have to know where the local healthcare facilities are. So in case if you need an ambulance, and if you need a nurse to like just help you with self-administering, or you need an emergency IV fluids, which doesn't really require hospitalization, because most doctors would actually prescribe you IV fluids and IV medications if you tell them that I know a nurse who can self-administer it to me, who can administer it to me at home. And that's gonna cost much less than an inpatient stay, in case you don't want to use your hospital your hospital benefits, or maybe you don't have an insurance, or you're just thinking that will cost you less. So these are like practical tips that I can tell you. And one more practical tip: if you can donate blood, then donate blood, because once you donate blood, you're gonna be given this donor card, and you will be prioritized in when you need a blood transfusion, or if somebody in your family needs a blood transfusion. And as far as I know, in the Philippines, they are trying to eliminate commercial blood banks, so it should be available from the national blood banks here in the Philippines. So those are the practical tips that I can tell you, and I'm gonna be putting on links down below. If you find them useful, just make your comment, and if you want to add more suggestions on the next video that I should be doing, please do let me know. So just like and subscribe if you find this useful. Thank you so much, and you have a good day.